Order, Mr. Bilirakis, 5 minutes.
Thank you. I appreciate it, Doctor. Mr. Shen, can you tell us about the role of generative AI, what it is, and what its potential can be within the healthcare sector? I know it's a general question, but and I know others have asked this question, but it's so very important. Please.
No, appreciate that, Congressman.
Yeah.
So certainly my colleagues have also talked about generative AI. So perhaps maybe I'll talk about it as it relates to medical imaging and where we see the impact
Sounds good.
for patients. So with generative AI here, where we see the greatest potential is the ability for the AI to consume more information about the patient themselves. So when a patient actually goes to get an exam done, to get a diagnosis, for example, leveraging generative AI gives them the ability to know exactly what precise diagnosis should we be looking for. Yeah, so not just doing a test just for the sake of doing a test on that patient, but actually doing a test because we're seeking a particular diagnosis that's happening there. So that actually, if you think about it, helps the patient not go through, avoid going through multiple exams just trying to look for what the issue is here. So that's potentially one area. The other area where generative AI has some benefit from a medical imaging standpoint is actually the interpretation of the images themselves. So the ability to be able to take all this complicated medical language and convey the diagnosis to layman's terms for the patient themselves. So the patient gets a better understanding of what's going on in the test results that they've had from that exam.
Oh, that's great stuff. We appreciate it. Very exciting. Mr. Shen, I appreciate that your testimony mentions the use of predetermined change control plans. And I was proud to lead the effort in the House last Congress to authorize the use of the PCCPs through my bill that got enacted into law last year. Can you describe the PCCP pathway and explain to us how this can allow for a more efficient regulatory framework and why it's so important to ensure that FDA implements this bill effectively?
Yeah, thank you, Congressman, and again, thank you very much for the PCC effort. Yeah, so enactment of the predetermined change control plan allows organizations like Siemens Healthineers to include in our initial FDA product application a description of how the software will be updated rapidly based on new data as it comes about. So without the need to have to resubmit back to the FDA any sort of application or supplement every single time an update happens. So this really helps accelerate and go in conjunction with all the rapid development around a technology like artificial intelligence. The PCC itself, we have to include a description of the modifications, the methodology that we're using, so we provide that transparency that's needed that we've talked about here today as it relates to that technology here. And again, we're very, very pleased that with your help there that we're able to move forward and make sure that PCCP is part of the FDA process going forward.
Thank you. Excellent. One question for Dr. Schlosser. Can you elaborate on the potential that large language models have in reducing provider burden within the hospital settings, please?
Yeah, absolutely. Thank you for the question, Congressman. So as I've mentioned in my testimony, I think there are numerous opportunities where our current healthcare system has created what we refer to as administrative burden, added tasks to physicians, nurses, pharmacists, other healthcare providers that don't directly add value to the patient, where they're acting as data entry analysts or transferring information between different providers or different systems. And large language models are actually really good at those types of tasks. If we can train them to understand the data, which is part of the challenge, they can search for information, read complex medical charts, find information from multiple disparate sources, synthesize and understand it, and then serve it up to the healthcare providers in their workflow. And then because they're language models, you can actually interact with them in a natural language way. You can ask questions and get feedback. And so it's a really powerful tool to make the universe of healthcare information around a patient simple and easy to access.
Very good. Good stuff. I'll yield back the rest of my time, Mr. Chairman.
Gentleman yields back. Now recognize